Pleased to say that the Vaccine Deployment Minister, Nadhim Zahawi, joins us once again on the programme. Mr Zahawi, good to have you on once again, and clearly lots and lots to talk about, very specific to your brief. But I wonder if we can start with that which a number of the papers appear to have picked up on this morning, that there was a meeting yesterday of the Prime Minister's senior ministers at which it was discussed that whether or not we need to see tougher restrictions or indeed tougher enforcement of existing restrictions. Just talk to us a little bit about that.
Thank you very much, Neil, for having me on. So the lockdown is actually pretty severe. We're asking people to stay at home, don't go out. If you have to go out, it's only for exercise. This virus loves social interaction, and we are all pro-social animals, and it's the worst thing we do is to socialise. So only going out for exercise, limited time, stay at home. We are concerned that, for example, in supermarkets, we need to make sure people actually wear masks and follow the one-waste rule in supermarkets. And of course, when they are at capacity to operate safely, people wait outside supermarkets. So we don't want to go any tougher, because this is a pretty tough lockdown. What we need is people to behave as if they've got the virus, and so that we can bring this virus under control whilst we vaccinate. And my role is very much focused on making sure that we hit that target of mid-February, where we protect those top 4 categories where 80+% of the deaths are coming from.
Just in terms, though, I mean, we mentioned several times supermarkets there, and also referenced in the papers. Is there some way by which we could be applying pressure on the supermarkets themselves to ensure that enforcement of the rules is a responsibility of the supermarkets and not just of the individuals?
Well, our plea is to everybody, each and every one of us. These rules are not boundaries to be sort of pushed against. These rules are there to try and make sure we bring this virus under control, reduce the pressure on the NHS, save lives. That's the really important thing. And as I say, this virus loves social interaction. I know it's hard. We're all pro-social animals, but just think, every social interaction you may have, that could be an incident of transmission of the virus. The supermarkets have done a tremendous job, and I want to compliment and thank them all for the incredible work they've done, and also coming forward to help with offers for areas where we can use for vaccination, hubs and others. But ultimately, the most important thing to do now is to make sure that actually enforcement and, of course, the compliance with the rules when people are going into supermarkets are being adhered to.
I mean, compliance is clearly something of an issue. Anecdotally, look, anyone who took a drive on Saturday or Sunday this weekend may have been slightly struck by the scenes that they saw. People congregating, people grabbing coffees. I mean, what do you say to those people who are clearly exploiting loopholes within the COVID-19 regulations? We're looking at pictures from Victoria Park at the weekend. People have clearly gone out to take their exercise and just happened to have bumped into people. I mean, are they not simply displaying the same common sense that the government told us that Dominic Cummings was?
All I would say to people is this virus loves social interaction, especially this new variant, which is far more infectious. And I know it's hard. It's very hard on us all, because, as I said earlier, we are all pro-social. We want, it's in our DNA, dare I say, that we socialise. But this is the worst thing we can do in terms of helping the virus spread further. We must make sure that we only go out when we exercise, or obviously to get some necessary shopping done, but otherwise stay at home. That is the message. If we all follow that rule, stay at home, then we will bring this virus under control. And of course, the vaccinations are really beginning to ramp up. 200,000 a day. We've done, an incredible job this past week, 4th to the 11th of January. You'll see later today when we publish the figures. We've had a really significant ramp up in vaccinations, sure. And we'll do the same and more next week and the week after. And by mid-February, we will have protected those top 4 categories. And then we keep going beyond that, all 9 categories.
Sorry, can we just be very specific? When you say that by mid-February we will have protected the most vulnerable categories. What do you mean by that? Do you mean that by mid-February we're going to see 14 million people having been vaccinated? Because that isn't the direction we're receiving from Downing Street this morning.
So the top 4 categories, actually for the UK, is 15 million people. In England, it's about 12 million people. So we would have offered a vaccination to all those people to make sure that we can protect them. Obviously,
well, that's, I'm sorry, Minister, but that is somewhat different from what you said a second ago. 40 million people would be protected. No, that's not the case. As you say, it's 14 million people will have been offered a vaccine by the middle of February. And providing us a running total of how many people have been offered a vaccine, what use is that? I mean, that just tells us how good the Royal Mail and the mobile phone companies are at communicating. We need to know how many people are going to be vaccinated by mid-February. So when will the 14 million people have received their vaccination?
You're absolutely right, Neil. And when you offer a vaccination, it doesn't mean a Royal Mail letter. It means actually the vaccine and the needle and the jab is ready for you. And so what you'll see us publishing is the total numbers of people being vaccinated, not being offered a vaccine. And that's the number to hold us account to.
OK, in terms of the rollout itself, the 7 mass vaccination centres will be music to the ears of people who are waiting to get there. I do wonder, however, that the 45-minute travel time, what happens if, for example, an older person is unable to make that journey? This is not their only shot at getting a shot, is it?
Absolutely right, Neil. It's very important to remember that this week is the first week of the rollout of the vaccination centres, 7, as you introduced in your piece, more next week, more the week after. And yes, at the moment, the 600,000 letters that have gone out are to people 80-year-old plus in those top 2 categories. And of course, we'll move down the categories down to the 4 top categories, where the travel times are up to 45 minutes. That will obviously change. Plus, they have the option not to take that particular route and to wait for their GP to vaccinate them. So they have other options. And what I want to get to is to make sure that every adult in England has the ability to vaccinate within 10-mile radius of where they live. That is our absolute focus. That is what you'll see us do. We will roll out more vaccination centres next week, and the week after, we'll bring on the community pharmacies, 200 as the Prime Minister announced at the press conference a few days ago. So this is an enormous rollout, the largest vaccination programme in the history of this country. But I'm confident that through GPs, obviously through hospitals, that we've already got 220 plus hospitals, over 1,000 GP primary care networks, by the way, who are already supported by pharmacies as well. Then the vaccination centres and, of course, pharmacies, you will see the ability for people to get a vaccine become easier and easier in days and weeks to come.
I wonder if we might ask about a couple of categories of people who have been looking to secure the vaccine more quickly than the system currently allows. Police officers on the front line throughout all of this. And now we understand some of them, a small number, a handful, obviously, 75 of them are going to be drafted in to start driving ambulances. Is it not now time to start thinking about, you know, making sure that the coppers out there on the front line have a vaccine sooner rather than later? And also, just a related topic, beginning of December, we spoke to Fred Banning, himself, who suffers from stage 4 bowel cancer. It is a terminal condition, and there are people in his circumstance who are asking for the vaccine earlier than currently, so that they can, in essence, extend their time with their family. We were told in December that the government was looking at this. I'm just wondering what the state of play is today.
Thank you. You're absolutely right to talk about sort of police officers, teachers, of course. So the phase 1 that I'm very much focused on delivering is the categories that the Joint Committee on Vaccination and Immunisation have set. They've looked at all cohorts, you know, in terms of different professions, teachers and police, but actually the relationship with age, and of course those who are clinically vulnerable to death from the virus are the ones that we're focused on, because if we can take them out of harm's way, if we can protect them with the vaccine, by mid-February, if beyond that, within 2 weeks, they would actually get that immunity, then we would have cut the deaths down by 80+%. And of course, once we get through the whole 9 categories, that's 99% of deaths. Some police officers, of course, and teachers will actually get the vaccine because they are in those categories. But we will very quickly move on to those other critical workers in the economy. And of course, those who are doing an incredible job, like our police men and women, in protecting us and of course, enforcing the rules at the moment, will also be in that the highest category of phase 2.
Mr. Zahawi, we will no doubt speak again very soon. For now, though, thanks very much indeed.
Thank you.